Contraceptive. Contraception has become a fundamental part of the healthy lifestyle of 1 billion people, including women and men, in recent years, but it remains one of humanity's most pressing concerns. This challenge is embodied in the need to spread contraceptive use throughout the world in a controlled and organized manner in order to mitigate the effects of population growth, as World Health Organization projections indicate that the world population, which is currently around 6 billion people, will continue to grow until it reaches nearly 8 billion in 2025 and more than 9 billion in 2050. There is currently no perfect form of contraception that is 100% successful in preventing conception, free of symptoms, side effects, or health hazards, easy to use, and inexpensive. It is followed in the process of assessing the efficacy of contraceptive methods, see table below, to measure the efficacy of the method when it is applied in an accurate, correct, and integrated manner, and to compare it to the efficacy of the method when it is applied in the normal manner. That is, when taking into account things like forgetting to take the contraceptive pill or a condom breaking due to improper use. Contraceptive methods. Contraceptives are usually divided into two categories. Contraceptives that are reversible, changeable. Contraceptives that are irreversible. Many countries prefer to utilize reversible contraceptives, which are often classified into 5 categories. 1. Natural contraceptive methods are the first group. That is, the isolation method, or withdrew intercourse in which the penis is withdrawn from the vagina, before ejaculation, coitus interruptus, and the safe days method. The predicted date of ovulation is computed using this approach, safe days, by subtracting 14 days from the average menstrual cycle for the previous 3 menstrual cycles. During the 3 days leading up to and following the estimated ovulation date, avoid sexual activity. Other methods for determining the date of ovulation can be used, such as constant monitoring of the body's core temperature. Pay attention to, and track, changes in cervical mucus, which becomes more fluid and copious during the days leading up to ovulation. This procedure, however, is not ideal for women who have an irregular menstrual cycle. Rather, it goes against a woman's desire to have sexual interactions during her ovulation period, when her libido is at its height. These natural techniques have no side effects and are free of charge, but their usage is restricted due to their low efficacy. 2. The second group consists of insulating materials. Several methods are included in this group, including condom. The condom is the most popular method in this group. Due to its efficiency in avoiding sexually transmitted illnesses, condom use is especially crucial for couples who are having intercourse, STDs. The female condom is a relatively recent technique of contraception. Its advantage is that the lady can insert it herself into the vaginal canal, giving her complete control. For a long time, the female diaphragm has been a well-known method of condom. The diaphragm is a flat cup made of flexible material that is put into the vaginal canal along with a spermicide to prevent sperm from entering the cervix. For the doctor, the diaphragm is appropriate. Barrier contraceptives have low negative effects, however they have limited efficacy. 3 preparations for spermicides are the third group. Nanoxynol 9, a spermicide that affects sperm cell membranes, is the most frequent. Spermicides come in a variety of forms, including vaginal pessaries, lotions, and foams. Due to their low efficacy, spermicides are now only recommended to be used in conjunction with barrier techniques. The vaginal sponge, which is a combination of a barrier technique and a spermicide, is available. 4 hormones are the fourth category. Hormonal contraception is now regarded as one of the most essential techniques of contraception. The combined oral contraceptive pill is the most well-known method in this category. IUDs are the fifth group. The intrauterine device, IUD, is the most successful and common method of contraception, particularly among moms aged 30 and up. Today, effective IUDs are employed, which means that their contraceptive efficiency is dependent on the uterine cavity's release of copper or progesterone. The contraceptive coil is effective for at least 5 years. There is a minor danger of infection inside the uterus in the early days of the IUD insertion, an operation that must be conducted by a doctor, but the IUD, does not cause any serious damage to future fertility.